Hangovers. So most people think that a hangover is just dehydration. So from a medical standpoint, that's only a small part of what's actually happening. A hangover is a multi-system physiologic stress response. So when alcohol is metabolized in the liver, it's converted into acetaldehyde. That's a toxic byproduct. So acetaldehyde increases oxidative stress, it drives inflammation, it disrupts blood sugar regulation, and rapidly depletes antioxidants that the body relies on for normal cellular function, okay? So at the same time, alcohol increases fluid and electrolyte loss, it irritates stomach lining, it alters neurotransmitter signaling, and it places metabolic stress on the liver. So that's why hangovers aren't just headaches. They include nausea, brain fog, fatigue, palpitations, light sensitivity, and body aches. So from a physician's perspective, recovery isn't about one ingredient. It's about supporting multi-physiologic pathways at the same time. So that's how our hangover IV is designed. Our hangover supreme. So alcohol metabolism consumes glutathione, the body's primary antioxidant. So when glutathione is depleted, oxidative stress rises and recovery slows. So that's why we use glutathione directly with acetylcysteine, which helps the body replenish its own glutathione stores, okay? And alpha-lipoic acid, a powerful antioxidant that supports mitochondrial and cellular function. It also interferes with energy production at the cellular level, so that's where B vitamins matter. So a hangover supreme includes a full B complex, okay? For glucose metabolism and neurologic function, riboflavin and niacin for cellular and energy production, pantothenic acid for metabolic support, pyridoxine for neurotransmitter synthesis, and biotin and folate for cellular repair and red blood cell production, okay? So these aren't stimulants, they support how cells actually make energy, which is why people feel clearer, less foggy as the recovery progresses. So alcohol also irritates the gastrointestinal tract and increases acid production. So that's where famotidine comes in. It's used to reduce gastric acid. And ondansetron, it may be used to help control nausea by acting as a serotonin pathways in the gut. So improving comfort basically allows the body to recover more efficiently. So inflammation plays a role in a hangover, and headaches and body aches. So that's when it's clinically appropriate to use Toradol. It basically it's a non-opioid anti-inflammatory to help reduce inflammatory burden after medical evaluation. So a physician needs to prescribe you this, okay? So finally, alcohol causes significant fluid and electrolyte loss. So IV hydration helps restore circulating volume and improves delivery of nutrients to tissues. So that's why hydration alone isn't enough. That's why it's combined with metabolic antioxidants, anti-inflammatory support, and other various medications. So at Viva IV Therapy, all these treatments are provided after a medical evaluation and tailored to the individual. So our goal isn't to cure the hangover, it's to support the body's natural, normal recovery process safely and appropriately, understanding that physiology matters, because the better understanding leads to better care, and that's medicine, okay?